Hey guys, welcome. Today we are going to do some exam prep. And what I want to do really quickly, you guys can just come in, let me know where you're watching from, let me know if you're in school. While you guys are doing that really quickly, I'm just putting something in the description box. I want to make sure I put the link to my MA refresher course in the description box so you guys have access to that. So you guys know, in addition to doing these study videos, I also actually have an online study guide for you guys. So I'm making sure I leave that link. So that link is in the description. And then really quickly, let me just on Facebook, because I'm live on Facebook and Instagram, I just want to quickly share this live into my Facebook group as well. The Medical Assistant Lounge is my Facebook group for those of you that don't know. So let me just share the live into that group really quickly. 1 second, guys, and we're going to get this started. Live study session. Okay. Happening now. And let me share this in my group. I wish I could go live into my Facebook group. They don't let you do that anymore. They used to, this software that I use used to allow you to go live in your group. And that would have been so nice to do right now, but you can't do it anymore. All right. So anyway, let's go ahead and get started. Do me a favor, guys, as you come in, just let me know, where you're watching from. And then if anybody is new here, the way we do these certification practice videos, I will read the question and then I'll give you guys a couple seconds to answer the question in the comments, and then I'll move on to the answer. If you are watching this video as a replay, then of course you won't be able to answer live, but you can feel free to comment and answer as you watch it. And then make sure you guys are taking notes. So you guys should not be on this exam practice without actually taking notes, okay? So, you're getting prepared. This is how you study. So first of all, let me get into it. Let me just introduce myself for anybody that may be new here. You guys know my name is Kendra, aka Ms. K. I became a medical assistant in 2004 and a medical assistant instructor in 2011. So I do exam prep and consulting. I work with different schools to get students, prepared for examination. And then I'm also an entrepreneur and creator. So in addition to the medical stuff, I have my own business and other things that I do on the side, okay? So I just mentioned this, that I put the link to my MA refresher course in the chat. So that is an online study guide. And this is for anybody that's preparing for any of the certifications. So if you're taking like the CCMA, the RMA, the CMA, any of the clinical exams, you want to get the clinical course. Okay, there's video lesson quizzes, as you can see on the screen there. You get quizzes and then also practice tests. Okay, over 400 practice questions are on the MA refresher course. Okay, and then you get a score with each quiz. And so that's available there. You can click the link in the description. I'll also leave it in one of the comments as well. And then I have an ebook. This is for anybody that's in a medical field, whether you're a medical assistant or a nurse, and you want to use your clinical skills to start a business like I have. And it doesn't even have to be a clinical business, right? It could be any type of business. That ebook is linked in the description as well. Okay. And let me just make sure you guys can hear me. Everybody can hear me before I get started. Just confirm that you guys can hear me. I know I had some sound issues the other day, so I want to make sure before I get into it that you guys can hear me. Anybody? Let me see. Let me look at the chat really quickly. Can you guys hear me? I know there's a delay. There's somewhat of a delay. Okay, perfect. All right, so let's get into it. All right. How many chambers of the heart are there? How many chambers of the heart are there? 1, 2, 3, or 4? How many chambers? Okay, if you said 4, you are correct. Okay, next question. Name the 4 chambers of the heart. So I'll give you guys a few moments to write that. Name the 4 chambers of the heart. What are we just said that there are 4 chambers. Name them. Can anybody name the 4 chambers? Give you guys a couple more seconds. All right, if you said 2 atria and 2 ventricles, you are correct. Atria is on top, ventricles are below. All right, next question. And one thing I should mention too, there's a left and right atria, of course, and then a left and right ventricle. Did you take your medication today? Is this an example of an open-ended question or closed? And so you guys know I've been doing these open-ended questions. While you guys are answering that, I'm just going to take a moment doing these open-ended questions, because if you can simply answer these questions, this is how you know the information. You guys are always asking me for study tips. This is one of the main things that I always say: be able to answer open-ended questions, okay? Be able to answer questions like this. Like, I should be able to ask you a question and you answer it without needing to see multiple choice answers, okay? So even though the test is multiple choice, I need you guys to be able to answer questions like this. So this is why I've been doing this style where I'm just asking you questions and you have to answer versus doing multiple choice questions. Okay, so if you said close, you are correct. So yes or no question is a closed question because all you asked the patient was, did you take your medications today? Now, if you were to ask your patient, can you tell me which medications you've taken today? Is this an example of an open-ended question or closed? And I'll explain the difference between the two in a moment. I just want to give you guys a chance to answer first. And if you happen to be watching this and you are getting the answers incorrect, it's okay. This is why I do these study sessions, so you can get your practice in, right? And if you notice there are some things on this practice, on this practice session that you don't get, guess what? That means that you need to go back to your study material to study it a little bit more. All right, so if you said open, you're correct. So the difference between the two is that, notice with the closed question, it was literally just a yes or no question. So closed questions mean that your patient, can only give you a yes or no question or one word answer, right? Whereas with an open-ended question, once that patient has to tell you what medications they took, that's an open-ended question because then they have to explain. So anytime it's like a yes or no question, that's closed. And then anytime they have to actually answer a question and actually explain, that is an open-ended question, okay? According to Maslow's hierarchy of needs, what is the highest level? According to Maslow's hierarchy of needs, what is the highest level? Give you guys a couple seconds to answer. Okay. If you said self-actualization, you are correct. Now, what is the most basic level of needs? So self-actualization is the highest level. What is the most basic level? And do me a favor, guys, as you're watching this, I see 23 people watching. Well, 23 between Facebook and YouTube. Make sure you guys are liking the video if you are enjoying this. And if this is helpful, it's just a quick and free, easy way to get the video out to more people who might need it. Thank you, guys. Yep, if you said physiological needs like air, food, water, and sleep, you are correct. What part of the brain controls coordination and balance? What part of the brain controls coordination and balance? And again, yes, safety is one as well. Somebody mentioned safety. Yes, safety is one as well. Again, guys, I'm asking you these open-ended questions because if you know what part of the brain controls coordination and balance, then you know it. I need you guys to be able to answer open-ended questions because that's how you make sure you know the information. Because a lot of times people are looking for the practice questions to be on a test, and that's not always the case. But when you study the material, then you know it. You know you're ready for the test, okay? So if you said cerebellum or little brain, you are correct. So that means if you see a question on a test and it's asking about, which one, they may even ask what part of the brain is known as a little brain. You may even see that. And they may throw some other things at you, but as long as you know the little brain is a cerebellum that's responsible for balance and coordination, it doesn't matter what type of question they ask because you already know what it is. And then what part of the brain is the largest and is responsible for your logic, emotions, sensory processing, and memory? What part of the brain is that? Again, if you know it, then when you see it on the test and they throw those other, options out at you, you know you're going to be able to eliminate cerebellum because we just said that's the little brain that's responsible for balance and coordination. So now if you get asked this, then you know at least you can eliminate cerebellum. All right, if you said the cerebrum, you are correct. All right, make sure you guys are taking notes as you are going through this. And of course, you can always go back and rewatch it. Which class of fire extinguisher should be used on flammable liquids? Give you guys a couple seconds and you guys should be taking notes. And then you can always go back and watch the replay. For those of you watching on Facebook, it only stays up for 30 days, but on YouTube, they stay up indefinitely. So you don't have to worry about losing access. So for anybody who's going to need this for more than 30 days, I highly recommend you guys go to YouTube. Okay. If you said class B, you are correct. Class B. What layers of the skin are affected by a second-degree burn? What layers of the skin are affected by second-degree burn? Make sure you guys know this. So first degree, second degree, third degree, make sure you guys know. And they even have a fourth degree now. So make sure you guys know what layers of the skin are affected by each. Okay, the epidermis and part of the dermis is affected by a second-degree burn. A patient informs an MA that she's been vomiting for 2 days. In which part of the SOAP note should this be documented? In which part of the SOAP note should this be documented? The patient comes in, you ask a patient what they're in for. Patient says, I've been vomiting for the last 2 days. In which part of the SOAP note should this be documented? Okay, so this is going to go in subjective. Remember, subjective. So SOAP note is subjective, objective, assessment and plan. Subjective is what the patient tells you, right? Objective is what you can see or what you can measure, like vital signs. And then assessment, of course, is the provider's assessment, and diagnosis, and then plan is what the provider plans to do. The beginning of one heartbeat to the start of another is referred to as what? The beginning of one heartbeat to the start of another heartbeat is referred to as what? Okay, let's see. Okay, yep. If you said cardiac cycle, you are correct. You are correct. What condition is characterized by excessive iron in the body? Excessive iron in the body. What condition is characterized by excessive iron in the body? Okay, let's see. Hemochromatosis. All right, if you said hemochromatosis, you are correct. What form is used by providers to bill third-party payers, aka the insurance company? What form is used by providers to bill third-party payers? Okay. If you said the CMS 1500, you are correct. The universal claim form, yes. Now, what form has pre-printed codes and makes it easier to fill out a claim form? What form do you use? It has pre-printed codes on it, and it helps you to fill out the claim form. It makes it easier. It makes it, helps you to fill out the claim form more accurately. What form is that? Pre-printed codes on it. And it helps you to fill out the CMS 1500 or claim form more easily. If you said encounter form, you're correct, also known as super bill. And that could be a question too. You may even say that. What is a super bill? Encounter form. So pre-printed codes, a lot of people, they end up answering claim form on this question. Of course, you guys can rule claim form out because we just mentioned that on a question before. But I notice a lot of people end up choosing claim form for this question. And remember, the claim form does not have pre-printed codes on it. On a claim form, you have to add the codes, and you add the codes based on the codes that the provider has chosen on the encounter form. So the provider fills out the encounter form. He or she checks off all of the codes, the diagnosis codes, CPT codes, and then you use the encounter form to fill out the claim form, okay? What quadrant is the spleen located in? The spleen. Which quadrant? The spleen. Where is the spleen located? Where is the spleen located? Okay, if you said the left upper quadrant, you are correct. Or LUQ, you are correct. What are some examples of an adverse reaction? Now, this is going to vary. I know you guys are going to have different answers, and I'll give you guys a few seconds to put it in. But I want to see if you guys can spot some I'll see if you guys can give me some examples of adverse reactions so you can, you'll be able to answer that question if you come across them, or if you see a question that asks you, which of the following is an adverse reaction. You may have to choose between, adverse reactions and side effects. So let me see if you guys can give me some adverse reactions. Let's see what you guys are putting in the chat. All right. So some adverse reactions include liver or kidney damage, blood clots, anaphylaxis, internal bleeding. Now, before I talk about the difference between the two, let me get you guys to give me some example of a side effect. So you gave me some examples of adverse reaction. What are some examples of a side effect? Let's see what you guys are putting. Okay, so some examples of a side effect is nausea or upset stomach, drowsiness or fatigue, and a mild headache. So the difference is that adverse reactions, they tend to be more serious, and they are a direct, effect from taking the medication. Could be long-term, usually unpredictable, right? Side effects are usually expected. Like, certain medications will make you feel make you feel some nausea, maybe even dry mouth as well. So also drowsiness, you may feel sleepy. But then if you have anaphylaxis, that's considered an adverse reaction, like that could lead to death. And then you have as a result of taking some medications actually cause liver damage or kidney damage. And that is an adverse reaction. So much more serious, unpredictable, and of course is a direct result. And it's not something that just stops when you take when you stop taking the medication, right? So if you're feeling nausea and you stop taking the medicine, usually it'll clear out. Whereas an adverse reaction, it doesn't just stop just because you just stop taking the medication, because it's an effect that actually, could last a long time and maybe even be fatal. What kind of service does a clearinghouse provide? A clearinghouse. What is a clearinghouse? Oh, let me just pause and say, Amber, I see you live on Facebook. Listen, I'm doing better. I'm not having a whole lot of side conversations. Listen, I appreciate you guys' feedback. I've been doing better when I'm live. I'm just sticking straight to this. I just wanted to make this side note really quickly while I'm on here. But I know you guys, when y'all watch the replay, it can be very distracting. So I have, limited the amount of side conversations until the end where I answer a few questions. So hopefully this is better. All right. Somebody said adjudication. That was correct. And that means to review claims before sending to the insurance company. So they'll review the claims to make sure that the claim is what's called a clean claim, that just to look for any errors, just make sure everything is good. When diagnostic coding, and what part of the ICD-10 CM manual do you begin? What part of the manual do you begin when you are diagnostic coding? You're looking for a diagnosis code. Where do you start? Where do you start? And what part of the manual, the ICD-10 CM manual, do you begin? You're going to start in the alphabetic index, okay? Or volume 2 is what it is. So alphabetic index, okay? You don't start in a tabular list. You start in alphabetic index, and then you cross-reference, which is also something that they may ask you about. You cross-reference in volume 1, okay? So you start in volume 2, and then you go to volume 1 to cross-reference to make sure you got the correct code. All right, which vein is used as a last resort? Which vein is used as a last resort? Which vein are you going to use as a last resort? So you're looking at your patient's arm. You got the cephalic, got the median cephalic, and you got the basilic. Which one is the last resort vein? You got the cephalic, median cephalic, and basilic. Which one is the last resort vein? If you said basilic, you are correct. The one toward the inner arm, that's your last resort vein, okay? You always want to go for the median first, and then if you can't, there's nothing there, then you want to look at the cephalic, nothing there, then you go for the basilic, okay? Which link in the chain of infection stores an infection? Which link in the chain of infection stores an infection? Which link in the chain of infection stores an infection? All right, if you said reservoir host, you are correct. You are correct. That's where it starts. That is the host. The reservoir host is they call the incubator. What virus causes mono? What virus causes mono? All right, Epstein-Barr. What is nephrolithotomy? Nephrolithotomy, what is that? Is that a condition or is that a procedure? Like, what is that? Nephrolithotomy. Nephrolithotomy. Okay, so otomy should have definitely told you that it was a procedure, right? Otomy, definitely know that it's a procedure. One of the things I will mention too is sometimes when you see questions like that, you'll be able to easily rule out like a condition or something like that, because that's how some of them will try to get you. They'll throw in, like, let's say it's a procedure, they may throw in some conditions. So that's an example of being able to rule out, right? Same thing if it's a condition, they may throw in procedures and you can easily rule those out. But anyway, otomy, it's not otomy necessarily, because ectomy is actually removal of. So otomy could just be cutting into, right? Cutting into. Now, if it said ectomy, that's definitely removal of. But the procedure itself, nephrolithotomy, is removing kidney stones. But of course, when you see otomy, otomy is cutting into or incision, right? Usually to remove them, though. They're not going to just cut into them. They're going to actually remove them. And then litho is kidney. I'm sorry, litho is stones. And then, of course, nephro is kidney. What is myalgia? Myalgia. What is myalgia? Muscle pain. Algia is pain, guys. Remember, algia is pain. All right, let's see. What tube is used for hematology tests? Okay, sorry guys, my food just arrived. My Uber Eats just arrived. Sorry about that, guys. All right, if you say lavender or EDTA, that's correct. So sometimes when it comes to the tubes, they may actually say the color of the tube, or they may just name it by the additive in the tube. So make sure you guys know the additives in your tubes, okay? Because they may not list it as lavender. It may just say EDTA. What tube is used for coagulation studies? All right, let me see what you guys are putting. Okay, so if you said light blue or sodium citrate, you are correct. All right. What two body systems work together to maintain homeostasis? Give you guys a few moments to think about it and put your answer in. What two body systems work together to maintain homeostasis? Okay. I see somebody said endocrine is one. Okay. Any other guesses you guys have? All righty. So if you said endocrine and nervous system, you are correct. So they both detect changes and send signals to the body to react. Okay. So one example is sweating when you're hot or secreting insulin after you eat. So you guys know our pancreas makes insulin. So our endocrine is responsible for our hormones. Of course, our nervous system is responsible for, it consists of our brain and our nerves. And so they both work together. They both receive signals. Like for an example, even like your brain, when something is hot, let's say you touch something and it's hot, like your brain will, first of all, let you know it hurts, and then, make you pull your jerk your hand back, right? Just stuff like that your body, your nervous system does to send signals to the body and to help it react. And then the insulin I was mentioning, like when you're eating, our body, I'm saying your, like, I don't have a body too, but our bodies secrete insulin, especially as our sugar levels rise. Okay. All right, guys. So this is going to be it for today. I'm going to do these more often because this was pretty easy for me to create. As long as I'm doing open-ended questions like I did, I can do these more often because I'll see how many I can answer really quickly before I end this. Don't forget my study guide is linked in the description of the video. I'm going to put it here in the chat as well because Facebook does not show the link to the study guide. So let me just put it here. I know you can see it on YouTube, but Facebook is just different. They just, Facebook want to be. Oh, Amber said I take my test on 7/10. I need. Okay, I'll definitely make sure I do more before then. I'm gonna try to. I know I can't do it today. Is Thursday, so I know I can't do it this week, but I can definitely try to do another one next week. Because as long as I'm only doing a few, like I think that was like what 25 that I just did. If I can just do a few at a time, then I can do these more. I can do them more often. Okay, let me see. Good luck to everybody that's about to take your test. Congratulations to everybody that has recently passed. Remember, as you guys are taking your test, flag all of the hard questions, and flag or bookmark, and then come back to those questions. Come back to those questions at the end. Okay. Somebody's asking about becoming an instructor. All you do is just look for schools in your area, find out what the criteria is for becoming an instructor, and then check out the videos that I have on this channel about becoming an instructor. Okay. If you need study tips, I have plenty of videos on study tips. Okay. So study tips is in a playlist on its own. Okay. Somebody's taking their test tomorrow. Again, flag those questions, spend time on those at the end. Okay. Don't waste your time in the beginning of your test on the hard questions, flag or bookmark them, and then come back at the very end and then spend time there. Okay. All right, guys, I will see you guys. I'll probably go live, again within the next couple of days, but I won't do this study practice until hopefully next week I'll be able to get something done for you guys again. Okay. I'll see you guys next time. Be blessed.